Welcome in, everybody, to the My Pets Wellness Weekly Wellness Podcast. My name is Kevin Crispin. I'm the Chief of Staff of My Pets Wellness. Good to have you here again, and we're very pleased to have our co-founder, Dr. Jessica Miller, here with us today. Dr. Jessica, how are you doing today?
Hi, I'm good. Thanks for having me, Kevin.
You bet. Thanks for being here. We're going to talk about something today that goes on at every veterinarian clinic, hospital, and it's kind of the lifeblood of it. And that is the veterinarian-patient-client relationship. First thing I want to do is, when I came into the veterinarian world, I never heard the term patient used for an animal. And so I want to just, for anybody who's watching who may not know, tell us the difference between the patient and the client.
Well, the patient and the client, in the veterinary relationship is I have to work to be the best advocate for the dog or the cat or whatever you're treating. Because obviously dogs and cats, they can't raise their hand and say, hey, something hurts, or they can't tell us about it. And again, they don't speak English. And most humans don't speak dog or cat, and they're not as familiar with the signs and symptoms as veterinarians who are the trained professionals. So my job is to really be their advocate, to explain to the owner, okay, I realize that you don't think your animal is pain, but here are some of the signs and symptoms that tell me that your pet is in fact in pain. And I just want to point those out because I understand you don't speak dog. And so you are probably unaware. And I can speak of a time where I had a human anesthesiologist walk in the door with their golden retriever who is holding its leg up. And she had no idea that this dog had broken its leg. And she did not think that this dog was in any pain. And this is a human doctor who is trained to notice human pain.
What did the client think was going on? They were just
they came in because the dog was lifting its leg up, but she had no idea that the dog was in pain because in her mind, if the dog was in pain, they should be crying. They should be whining. They should be in significant distress. Not realize that for a golden retriever whose attitude is people-pleasing, whose attitude is, okay, because I'm a pack animal, I can't show weakness because that could convey that to a pack, to other members of a pack. She's not trained to pick up on those signs, so she didn't think that this injury was significant.
Got it.
So luckily, again, I was able to understand that, okay, a dog that's not bearing any weight has a very significant injury. But again, that's just a clear example of, someone who's a medical professional, but again, they were equating what a human does when they're in pain or breaking a leg versus a dog or cat, which they just don't show symptoms the same way.
So I love what you said a moment ago, which is like, obviously animals don't speak English and owners don't speak dog or cat. And you have the training, and veterinarians have the training to look for those other signals. So would you say that the relationship between you and the client is that you're kind of helping translate what you see to be the issue with the patient to the client and advocate for that patient?
Absolutely. So the best relationship is where I can gain the client's trust.
Yeah.
So the most important thing is that as a veterinarian, we come across in a professional manner that the owner not only thinks that we have the knowledge to treat their pet, but also thinks that, okay, I really do have their best interest in mind. And that is that trust, that without that trust, that client might not go for the treatment recommendations that I give because maybe they're suspicious of my motives. Maybe they're thinking, oh, well, they just want to run that test for the money. But again, the best relationship is where there's that trust and the client knows, no, if they're recommending something, my pet really needs it.
And as you first meet a client through maybe 10 years of working with that client, is one of the most valuable things of that relationship, the trust that you two build together and the joint interest of the patient to only flourish. Yeah.
Yes. of course, like the best relationship is those long relationships because you get to, every dog and cat is an individual, just like every human is an individual. And so you really get to know the client, and you get to know what the client's needs and priorities are, how they view their animal within their family, as well as the pet. You get to understand the pet's signals and triggers, things that they like, that they don't like, and also what's normal for them. Because what's normal for this dachshund is not the same as what's normal for this golden retriever. So this dachshund is very sensitive. He likes to whine and cry for sometimes attention and not necessarily pain or discomfort. Whereas this golden retriever, they never whine. So if they're whining, then something is definitely significant wrong. So again, you just get to know those patients, know what signs and signals they're giving off and kind of what that means. And you get to establish that baseline. So when something is different, you really pick up on, okay, something's different here.
Okay, great. So, so we've got you, the veterinarian, we've got the client who's brought in their animal, and we have the patient who's the animal. What role does each of those play in the forming of this relationship and then growing it into that long-term relationship where you're seeing that animal every so often?
Sure. So at the beginning, you're introducing yourself. You are getting to know both the client and the patient. So again, this at the beginning, everybody is very timid. You know, the client is timid. The animal is timid. Maybe even the doctor is timid. Again, not knowing how receptive this client is going to be to what they suggest. And again, over time, hopefully that comfort level increases. The comfort of the client increases where, okay, I feel confident that if I tell my doctor XYZ, they're going to really take that seriously, and I'm going to feel heard and understood. And as well as the pet, you know, maybe Fluffy or, you know, Jojo comes in and they're really scared and they're hiding under the table or the chair. And, you know, we give them peanut butter, we give them treats, we give them pets and scratches, and they learn, okay, this isn't always a scary place. Hopefully they warm up to
Not
us.
always a needle or anything like that.
Exactly. At our facilities, we always encourage happy visits. So for dogs and cats, well, typically dogs, that again are very squeamish of coming to the vet, they can come in just randomly. And we can even put them on the scale, give them a treat. Maybe we even put them in an exam room, give them a treat, and that's it. And then they walk out the door. So that desensitizes them to that environment. And once again, you know, with your patients that have certain triggers, you know, you have certain dogs that are very sensitive with touching their paws, or maybe they're very sensitive with touching their ears. And you get to know that, and you get to know how they like to be handled. So, you know, when we do a nail trim, maybe this dog is standing on the ground, and we're doing very minimal restraint. This other dog, they, you know, prefer being held, you know, being held up and cradled. So, you know, again, you get to know those things. And again, you also get to know their history, especially with chronic disease. So you get to see that progression and hopefully see improvement. Or again, you've got a much better gauge of how, you know, how significant any of those abnormalities are.
And then you, for somebody who may have a chronic illness, then you say to the client, hey, when you go home, take a look for this, this, and this. And it's almost like you're teaching them how to talk dog or cat or whatever, so that they can also be the advocate, and like you're all in it together.
Absolutely. One of the biggest part of my jobs is client education. So that is the hugest part of a veterinarian's job, because again, the dogs and cats, they don't take their medicine themselves. Someone has to give them their medication, sometimes force the medication. They have to follow, you know, the recommendations. They can't do that without their owner. So the owner has to be educated on the importance of that, so they can hopefully take it seriously and want to comply with that, as well as we have to teach them how to do that. As simple as, you know, training them how to give an animal a pill. Luckily, we've got lots of tips and tricks that we can help them with to teach them with that. That's why at My Pets Wellness, our appointments are longer
Mm-hmm.
because that's a big, important piece is educating the client. And if somebody's being rushed in 15 minutes, it's okay, here's your meds, see you later. Instead, we're hoping to, again, be able to educate them, take a thorough history, as well as to teach them how to do the things that we're recommending.
So what can a client do when they come in with their animal, whether it be the first time or the 15th time, to help foster the relationship between the client, the veterinarian, and the patient?
So I think that, try to stay as informed as possible.
Mm-hmm.
So, coming in with being an advocate for your pet, saying, you know what, Fluffy's doing this or Fluffy's doing that. If they're giving you subtle signals, you may not know if it's significant or not, but you don't have to be the judge. That's what our job is for. So the best thing you can do is come in there with, okay, this is what I'm seeing in my pet, as well as if your pet is on medications and you're seeing a new doctor for the first time, you bring those medications with you. So I can just read the label. You don't have to guess it. Oh, I think it's this white pill. It looks like this. Okay, I've got the medication bottle.
Narrow
I know
that down a little bit.
Exactly. Like take the best thing you can do at a new visit if your pet's on meds is bring them with you.
Okay.
Show them to your doctor. Be like, this is what they're on.
Mm-hmm.
Totally straightforward. And then again, listen, ask questions. Don't be afraid to ask questions. If you don't understand something, make sure you say, you know what, I don't get it. I don't understand. Because that's fine. We've got resources that we can help direct you to give you more information to help your understanding. So, again, we can't help if we don't know what we need to address. So be a good advocate, ask questions, and listen, and then, hopefully follow up.
And like you were saying, we try to have longer appointments so that we can have the most, accurate care, the care that we want to give. And then that goes back to the client too, to give them the time that they feel, hey, I have a question about why is he doing this, this, and this. And you guys can have an informed discussion, which will help the patient in the long run.
Absolutely. And I always have stressed at my practices that, again, that time is very valuable because, again, these animals don't speak for themselves. So so it's difficult. It's much easier to tell a human, take this pill. But again, trying to get that dog or cat to take that pill is a much different story. Or again, somebody has been diagnosed with kidney disease. That is very complicated. If you're a human, that's very difficult to understand and stay on top of that treatment. And so again, it's important to have the time to be able to go over those things.
Great. And then last thing, when you come in and a new client comes in with a new patient, you described a lot of different ways that the patient may act. Is there a certain way, having been practicing for as long as you have, where you can just see the patient and be like, okay, this guy is not going to like this, this, or that? Or is it more of a tactile thing? Like, oh, I touched his ears. He pulled away. Like, are there physical signs before you even have a tactile experience?
Absolutely. And again, that's part of the training that we go through as doctors. Mm-hmm. So there actually are, people have done a lot of research on the signals that pets give. They actually have pain scales for pets. Believe it or not, cats can make a certain grimace, and there is actually called like the grimace scale. And again, this is specific even for cats because, again, the signs that cats give that dogs do, they are completely different animals, dogs and cats, and give completely different signals. There are scales of aggression. So again, the first sign of aggression might just be a curl of the lip. Mm-hmm. The next sign of aggression, a little snarl. Then you've got barking. You've got the hackles up, the ears back. Then you've got snapping, and then the highest level of aggression is actually, a bite. But again, you've got a lot of signs and signals before a bite that, the veterinarian can pick up on that the owner might be unaware of.
Awesome. I mean, it's really fascinating, just even in this 10, 15 minutes that we talked, all the different things that are going on. One, when a client, patient, veterinarian meet, and then the relationship that can form, and by encouraging our clients to ask questions, be inquisitive, our vet is there to help, and everybody becomes an advocate for that patient. So, Dr. Jessica, I really appreciate you being here today. As always, we hope you come back soon.
Thank you. I'm always happy to be here.
Awesome. And for everybody out there, please come visit us at mypetswellness.net to find out more. We have a lot of great content and resources there, and we look forward to seeing you again soon. Until next time, take care. Bye.